Good afternoon. My name is Ben Greenfield. I'm the Director of Marketing at Helmer Scientific. I'd like to welcome you to today's webinar titled CDC Vaccine Storage and Handling Guidelines, What Healthcare Professionals Need to Know. Please feel free to submit questions during the webinar using the questions pane. We will have time to answer questions at the conclusion of the presentation. I'm very pleased to introduce today's speaker, Alex Evans, PharmD and Certified Geriatric Pharmacist. He currently serves as the Pharmacy Manager at Seton Outpatient Pharmacy in Jacksonville, Florida, and as a preceptor for the University of Florida and Florida A&M University. He graduated Phi Beta Kappa from the University of North Carolina, Greensboro with a BS in Biology, and graduated with distinction from the University of North Carolina, Chapel Hill with a Doctor of Pharmacy degree. He has managed both community and long-term care pharmacies and has a specific interest in global public health. Alex has also completed work creating a stability database for various temperature-sensitive medications. Without further delay, I'm pleased to turn the presentation over to Alex.
Thank you, Ben, and it's a pleasure to be here. Thank you, everyone, for coming today. And just as a disclaimer, the webinar is being given in my personal capacity and does not necessarily represent the views of Ascension Health or any of its subsidiaries or affiliates. So what I did want to do today was I wanted to really go over, kind of introduce the topic of vaccine storage and handling. I think it's an often overlooked topic in healthcare. I wanted to discuss the risk associated with exposing vaccines to out-of-range temperatures, and I wanted to also introduce you to the CDC Vaccine Storage and Handling Toolkit, which is really the go-to resource. It contains virtually everything you would need to know about vaccine and storage handling to make sure that you're doing everything you can to protect your vaccine supply. And with that, I wanted to highlight just some of the things that I've seen that I feel like are common misses that I've seen so far in my career. And so with that, I wanted to first discuss selecting the thermometers. I wanted to then go over discussing refrigerator and freezer selection. And finally, I want to talk to you about best practices for handling temperature excursions, and in doing so, taking both the CDC recommendations, but also taking some of my real world experience to show you how to streamline and save yourself some time when handling an excursion while still handling it within the CDC guidelines. And this is a topic that I got interested in several years ago when I experienced my first temperature excursion in the pharmacy. And it is a very expensive thing when it does happen, and that's one thing that I do want to stress throughout the presentation is that the absolute best thing you can do is just think prevention first. And so when we're going over the thermometer and refrigerator selection, the vaccine storage and handling, the time to do that and look into that is long before there's ever a risk of an excursion. I know I've lost up to $25,000 between vaccines and refrigerated medications due to temperature excursions. So I really would hate to hear that happened to anybody here. So first I wanted to talk about what the risk actually is of exposing those vaccines to temperatures that are outside of the CDC recommended range. So I think nobody here doubts the importance of vaccines for the public health. And of course the milestones in vaccine have led to things such as the elimination of smallpox, drastic reductions in the incidence of polio, and actually now recently the eradication of polio in certain regions of the world, and we have drastic reductions, of course, in many other vaccine preventable diseases. But if we don't handle those vaccines correctly, then by the time we give them to the patient, they can actually be ineffective. And so they can lead to revaccination, and I really feel like revaccination, if we're lucky, to me one of the scariest things to think about is giving somebody an ineffective vaccine and documenting that vaccine is given and that patient thinking that they're protected, but they're not actually protected, so they don't know to get revaccinated. And they carry that risk for themselves as well as reduce the overall immunity of the entire population. And in addition to that, of course, we've all heard a lot of the anti-vaccine movement. It's really, unfortunately, a very strong movement in the United States. And if we are not storing those vaccines appropriately and we have to call patients back and say your vaccine was ineffective because we found out that it had experienced an excursion, then it's only going to make patients lose more confidence in us and in the vaccine itself. And finally, many providers, like I mentioned, including me, have suffered significant financial loss due to wasted vaccine. And of course, if you are keeping any refrigerated medications, then those medications as well. So there is a lot of money at stake here. So what I wanted to start with, first of all, was actually the mechanism behind the temperature sensitivity, because I think it's really important to understand that to see why, even if the vaccines look exactly the same, they don't hurt the patient when you inject it, same type, no injection site reaction, that doesn't mean that it's actually going to be effective. So on that picture right there that came from the CDC Vaccine Storage and Handling Toolkit, we have two different vaccines, one that was stored properly and one that was stored improperly. And as you can see, they look identical. It is impossible to tell the difference by looking at them. So when aluminum-containing vaccines freeze, which is the majority of the inactivated vaccines on the market, the aluminum oftentimes actually will conglomerate together and they'll form these large clumps inside the vaccine, and that causes a permanent reduction in efficacy because they cannot separate again once the vaccine comes back within range. The aluminum is key because after the vaccine is injected, the antigens will bind to the aluminum and actually improve delivery to the immune cells themselves so that the immune cells can take up that antigen and cause an immune response. So if you have a bunch of aluminum particles that have conglomerated together, then of course a lot less antigen will be able to bind to that aluminum and you'll get a drastic reduction in immune response. Other things that can happen, the viral particles themselves can aggregate together and clump. So obviously that's a drastic reduction in delivery of antigen to those immune cells as well. And also we can see conformational changes within the actual lipid bilayer, so the cell membrane of the antigen, or within the protein structure within a virus. So that protein can actually start unfolding, in which case it would not be recognizable to an immune cell, at least to the extent that it would provide immunity if that immune cell were to encounter an intact protein of that same antigen later. So I wanted to include a couple of documented examples. The first one is for the flu vaccine, and this is for increased temperatures, so above the CDC recommendations for refrigerated. The hemagglutinin protein, which is one of the primary proteins used in the flu vaccine to provide antigen, actually will start to degrade, and so it will start unfolding, and it'll do that 6 to 12 times faster than it normally would if it was kept in the refrigerator. And then freezing temperature, the Tdap vaccine has been well documented to be susceptible to freezing, and that's due to that aluminum conglomeration mechanism that I mentioned earlier. So just keep that in mind as you go through this, that even if you don't see any physical difference in the vaccine, this is actually what is going on in the vial that will prevent your patient from actually receiving the response that they need to receive to be protected. And here we have an example of another example of the cost of a vaccine loss. So this came from an actual family practice office, and they were using a household refrigerator at the time. And you see they experienced a temperature excursion over the July 4th weekend. So of course they probably were not there until the following week. And because of that, they ended up suffering a $14,000 loss. in vaccine, which I can guarantee you is much more expensive than a quality pharmaceutical grade refrigerator needed to hold that stock of vaccines. So the CDC in 2000, excuse me, not the CDC, the Department of Health and Human Services in 2012 conducted a survey because they wanted to investigate clinics to see to what extent they were actually abiding by the guidelines set forth by the Vaccines for Children program. And so during a 2-week period, they actually surveyed 45 different providers and did a thorough audit of all their vaccine storage and handling processes. And during that time, 76% of those providers had vaccines exposed to inappropriate temperatures for at least 5 hours during that period. So that is an incredible number. And as we mentioned earlier, the vaccine, the majority of them are not going to be effective after they've been exposed to that. So that means that in the vaccines that we were giving to our children, up to 76% of them potentially could have been ineffective by the time they were given. And just to really bring this point home, I wanted to include a picture that they put in that 2012 report on the bottom right-hand side. And you can see on the vaccine box there's actually an area where it started to freeze between the lid and the rim of the box. And so obviously that entire batch of vaccine is frozen and not good at all. However, it was in their refrigerator ready to be given. And so what happened after that is they really urged the CDC to try to take action to improve storage and handling guidelines across the country. And what was born out of that was the Vaccine Storage and Handling Toolkit. And it was last updated in June 2016, this year. And it's just an incredible resource to provide you everything you need to know on vaccine storage and handling. So if anything else, I just really want you to know that resource is available. It's a free download and would highly, highly encourage you to consult that resource. So one of the things that I see missed a lot is in regards to temperature monitoring. And so I wanted to go over a couple of the misses that I've seen in various healthcare facilities with actual monitoring the temperatures inside the refrigerators and freezers themselves. And just to expand on that 2012 study, they actually also found that a significant number of the providers had documented temperatures that were different than their independently assessed temperatures. So the Department of Health and Human Services put their own thermometers in the refrigerators, and what was documented on the log was very different. So it is an incredibly important topic, even though maybe some things sound basic or simple. So to start off with, I wanted to really just spend a little bit talking briefly about the proper selection of thermometers. I think it's, like I mentioned, it is an often overlooked topic. The CDC recommends the use of a continuous monitoring thermometer with a recording digital data logger with a current and valid certificate of calibration testing. So what that means is the thermometer is recording every, as I put here, every 30 minutes at a minimum, is taking a temperature. And each time it takes a temperature, it downloads it into a log that, depending on the thermometer, you can access. You see the thermometer on the left, you can access it through a USB port and download those reports into your computer. So you can actually see, in the case if there was an excursion, you can see exactly how long that unit was exposed to that excursion. And then another really important aspect is using a buffered probe. So you can see on the 3 thermometers on the left, all of them in this picture show a buffered probe, which means that the probe is actually suspended, usually in glycol, and in doing so it more accurately reflects the temperature inside of the vial. On the right hand side, one thing that I wanted to bring up is many medical grade refrigerators do include a built-in thermometer that conforms to all of this. So it does have a buffered probe. It's a probe that is built into the refrigerator, and it will record automatically for you with downloadable reports. Oftentimes that's available with pharmaceutical grade units. But regardless, this is the minimum for a thermometer. And I think that's a recent change to the CDC guidelines. They used to encourage the thermometer with the buffered probe, but not necessarily as strongly recommend the continuous monitoring. I'm personally really glad they did. I had one instance at a healthcare facility where we had an excursion, and I called the manufacturer, and we were doing everything we needed to do. We had a thermometer and a buffered probe. We were resetting the min-max, as we'll go over in just a few slides, but we were checking them twice a day, which is, again, what's recommended, but because of that, we had an excursion overnight, and I called the manufacturer, and they had data going out to 8 hours, and because we were checking it twice a day and I didn't have continuous monitoring, my excursion was roughly 12 hours, and so I ended up having to throw that medication away, which, if I remember correctly, was around $3,000 our cost, so it was a very, very expensive lesson for me to have to learn. And I would hate for anybody here to experience the same thing. So as I mentioned, some important characteristics is that the probe isn't a thermal buffered material. Oftentimes that's glycol. It can be some other materials as well. An alarm for out of range temperatures is really nice, and some of the newer thermometers will even hook up to the cloud where you can access it with an app on your smartphone, and it'll let you know even if you're not in the site if you've had an excursion. A low battery indicator is important. Current minimum and maximum temperatures are very, very important because you need to know not only what the temperature is at the time you read it, you need to know what the temperature was since the last time you read it. And the recommended uncertainty is plus or minus 1 degree Fahrenheit, and as I mentioned earlier, at least have a logging rate of every 30 minutes for that continuous read. Some devices to avoid. So one common one I see are the food temperature monitoring devices, the little stainless steel ones with the dials. If you were to actually put one of those devices towards the front of the refrigerator, you could actually open the door and watch the thermometer change in under a few minutes with that type of thermometer. And so it's very susceptible to the door opening and closing, even though that door opening and closing to get vaccines out of the refrigerator is not necessarily dropping the temperature of the vaccine inside the vial as significantly as that thermometer is indicating. And that's really why the majority of these are not recommended, is just they measure air temperature rather than vial temperature. And finally, the temperature monitoring devices do need to have a current and valid certificate of calibration, so that's just testing it against the lab and saying that the thermometer is indeed accurate, and it also is precise within plus or minus 1 degree Fahrenheit. Another thing you'll see sometimes with thermometers that's a requirement, and you'll probably see it on your certificate of calibration, is also called a certificate of traceability. And what that does is it actually allows you to trace the calibration of the thermometer all the way back to the National Institutes of Standards and Technology. So that organization calibrates thermometers for labs, which will calibrate your thermometer, and that's where the traceability comes from. So even though we have continuous monitoring of temperatures and we can download reports, and when there is an excursion we of course need to see exactly how long it's been out, I think it is a CDC recommendation. I think it's really important. I'm glad they left it in there that we need to continue checking the temperatures ourselves. The CDC recommends twice daily temperature readings, which is another common miss I see. I oftentimes see temperature logs that only allow you to record once a day, and staff that might only be recording once a day. And so we're going to need to record the current temperature, the date, and the time. And again, the time is important because of the case there's a temperature excursion. we need the minimum and maximum, and then finally we need the staff initials. And one thing that's important about the twice daily readings is it gives you a chance to actually look at the thermometer, make sure it's in range, make sure it's working properly. The absolute worst feeling you could have would be to not check these temperatures and just rely solely on that thermometer, that continuous read thermometer, to download reports, and then you either administer a vaccine or you sell a medication to a patient, and afterwards you find out that the thermometer had been telling you the entire time the refrigerator was out of range. So it's really important to keep an eye on those temps. And this section on checking the temperatures did come from a CDC document, and so it's got the 3 steps in there: the current temperature, also the min and max. If it's saying that it's currently 40 degrees inside the refrigerator, but it gives a minimum of 32 degrees, which is freezing, then you know at some point since the last time you read the temperature, the refrigerator actually got so cold that it potentially froze the vaccine. So that would be an excursion even though the current temperature is in range, because you did have an excursion since the last time you checked. Finally, after you check the min-max and the current and you log it, you want to reset the min-max so that the next time you go to check the temperatures, your min and max is only reflecting the period since you checked the last temperature. Okay, another thing that I see oftentimes missed, I really wanted to highlight, was proper selection of refrigerators and freezers and some of the CDC recommendations surrounding that. So the absolute best thing is to have a standalone refrigerator or freezer with enough space to accommodate your maximum inventory without crowding. So that means during flu season, you're getting your 500, your 1,000 doses of vaccine. That refrigerator should be able to comfortably handle it without crowding the refrigerator itself. The vaccines do need to be stored between 36 and 46 Fahrenheit. That is a recent change from the 2016 update. It did used to be 35 degrees Fahrenheit, and that's just due to rounding the 2 degrees to 8 degrees Celsius. There's some rounding there. So the most recent guidelines suggested rounding that temperature up to 36 degrees. The reason I say that is you might see some older forms that will still show 35 degrees as in range. And then our freezer temperature should be between negative 58 and 5 degrees Fahrenheit. So as I mentioned, the CDC recommends you use purpose-built, which means pharmaceutical-grade units designed to either refrigerate or freeze. And the reason you don't want combination units is that the cold air from the freezer in a typical combination unit will actually blow into the refrigerator, causing a lot of fluctuation. So the pharmaceutical-grade units usually have a microprocessor-based temperature control, and what that means is instead of you having to set the dial, and let's say in a household unit it goes from 1 to 9, and you're turning the knob trying to get it just in the right area between the 4 and the 5 and hoping it'll stay in the range. These units, you actually set the temperature, let's say for 41 degrees Fahrenheit, and it brings it within that range, so it takes the guesswork out of it. The forced air circulation is a design of the refrigerators that actually pushes more of the air more quickly through the unit, which increases temperature uniformity, and it eliminates your warm spots and your cold spots, which is very common in household units. It also allows a faster recovery of the goal temperature after the door is open. And these units typically also have safeguards to ensure the door of the unit remains closed, and that's a really, really important feature. To tell you another story about something I had been through, I was filling it in a pharmacy location that had a standalone freezer unit, but it was a household unit, and it didn't have the self-closing door hinges. It didn't have an alarm or anything. I pulled a Zostavax vial out of the freezer, went to vaccinate a patient. Little did I know, and since I was filling in there, I didn't know the freezer was prone to doing this. Sometimes when that particular freezer, you close the door, the door will actually pop out a little bit, and it left about I'd say about a ½ inch gap between the seal and the frame of the freezer. And by the time I saw it, I was closing up for the night. I was doing my twice daily temperature readings and going to check the freezer, and it was actually in the 40s. So just as a reminder, maximum freezer temp is going to be our 5 degrees Fahrenheit, so it was well above the range. And that one feature would have prevented that entire event from happening. Some other considerations for pharmaceutical grade units is custom configuration of shelves and drawers. I know we've all experienced that. There's too few shelves and they're spaced too far apart, and you can't really get things in there neatly, and that can lead to errors sometimes. Some manufacturers are registered with the FDA. They register their refrigerators as medical devices, and one of the nice benefits of that is that it does subject them to additional regulation in the manufacturing process, and it also subjects them to FDA inspections of the facility themselves. So it's an extra quality control, and I think it says something about a manufacturer that's willing to go that extra mile in spite of the fact that it's not required. They want to stand out and say, no, we are making a medical device, and you can come look at what we're doing and how we're designing them and how we're building them. And finally, some quality validation services and certificates are some nice additional features so that you have the documentation you need for the performance of that refrigerator. So the CDC, as I mentioned, does not recommend using a household unit like the one shown in this picture, the combination freezer and refrigerator. And if you read the guide, they will give you a lot of different guidelines on how you can make those units work. I would strongly encourage you to never use one of these units. This is the unit that caused me to throw away $25,000 in vaccines and medications, and they just don't hold their temperature. They have a lot of cold spots and temperature fluctuations. Dorm-style units should never be used. And unfortunately, partially due to this, studies published have estimated that up to a little over 1/3 of vaccines are subjected to accidental freezing. For example, putting it on the top shelf of the refrigerator in this unit could expose it to freezing because the freezer air is blowing into the refrigerator unit itself. As I mentioned, the dorm-style unit, refrigerator unit is the one that the CDC says absolutely no. And those units, you can tell what they are because they're the only ones that have a freezer actually inside of the refrigerator unit. So they have a single exterior door, and this is different from a medical grade compact refrigerator that's specifically built for holding vaccines. So the only thing that the two units pictured here have in common are the fact they're both refrigerators and they're both about the same size. But other than that, everything else is completely different. And just to go back to that picture of the vaccines for children's vaccine that was pictured in one of the previous slides that froze, that was actually taken out of a dorm-style refrigerator, and they kept it under the freezer unit, and that's why it started to freeze around the box. So just to show you some real-life data here, here's some data taken from both a household and a medical grade unit, and you can see the red lines are the represent the CDC recommended range, and since this is some older data, they use 35 as the recommended lower end of the range. But you can see either way, this household unit on the left-hand side fluctuated too much to even keep the vaccines in range. So you can see it had multiple excursions over, it looks like about a 1-month period, and likely all of those vaccines you would have needed to contact the manufacturer, but likely many of the vaccines would not have actually been good. And as you can see on the right with the medical grade refrigerator, we're keeping it in a real tight range. It looks like for a period of months it kept it within just a few degrees Fahrenheit. And same thing for a household versus a medical grade freezer. As you can see, the medical grade freezer keeps a much, much tighter range, so you can know that your especially your Zostavax, varicella containing vaccines are safe. And last thing about the refrigerator and freezer design itself, I really just wanted to go over was about the temperature uniformity that I had referred to earlier. So a lot of the, especially the household units, can have large temperature fluctuations. As I mentioned, the freezer air blowing into the refrigerator unit causes the top shelf to be colder than the rest of the refrigerator. The bottom shelf with the salad drawers typically are oftentimes are warmer areas of the refrigerator, so there's just a lot of fluctuation within those units. However, even with the purpose-built refrigerators and freezers, there can still be some difference in how uniform the temperatures actually are. The recommendation for refrigerators is for pharmacy is to be able to keep the temperatures within 1.5 degrees Fahrenheit, depending on where you are. And so I would encourage you to, prior to buying a refrigerator or freezer unit, to ask the manufacturer if they have some data on the temperature uniformity to make sure that they really are, they really do have the evidence to support what they're saying they can do with that unit. So what happens after you get your refrigerators? The first thing you need to do after you plug it in is you do need to give it some time to adjust and normalize the temperature, for you to set the temperature and make sure that it's working well prior to putting anything in that unit. Same goes with the freezer. So the last thing you'd want to do is plug it in, let it get to what you think is going to be the correct temperature, and put vaccines or medications in there, and then before you know it, it's not normalized and you have an excursion. So CDC recommends 2 to 7 days. I would say if you have a backup unit that's already set and the vaccines are safe in that unit, just give it the full 7 days and be sure that your unit is really set up. They do need space around the sides and the top of the unit to ventilate properly, and you really should only be using 1 unit per outlet, and absolutely no surge protectors. If somebody walks by that surge protector and flips the switch off, then you've already had an excursion if you don't catch it in time. And there's a lot of different labeling that you can put on your refrigerator unit, as well as the circuit breaker and the power outlet itself, to prevent people from unplugging it, adjusting the temperature, flipping the circuit breaker off. And a lot of those resources are available at the CDC website, as well as immunize.org, which is just an incredible resource for these types of things. So the last thing that I wanted to talk about was handling a temperature excursion, and I wanted to give you a step-by-step guide that takes the CDC recommendations, but also gives you a guide that will maximize your use of your time, because it is very, very time consuming to handle an excursion properly. So the first thing we want to do is notify our vaccine coordinator, and you should have a primary vaccine coordinator and an alternate coordinator that's very familiar with storage and handling guidelines. And you want to label your medications do not use and notify on-site staff. Again, you don't want them to sell or administer the medications or vaccines not knowing that you had an excursion because of a miscommunication. You want to move the medications to your emergency unit, and then you determine the maximum time out of range. So that's where the continuous monitoring log is going to be very, very advantageous. It'll allow you to quickly identify 2 hours, 4 hours, however long it was. The next thing you do is, for every single item in the refrigerator, I want you to record the lot number. the expiration date, and the manufacturer. And the reason you're going to record the manufacturer, I learned this the hard way, is that it does take some time to actually get through to most of the medical lines and to get to the right person. And the last thing you want to do is you call, let's say, for example, Pfizer, and you call them once about some of the vaccines or medications you had, and then you go back to your refrigerator and you find another Pfizer product, and then you have to call them back, and then you have to wait on hold or whatever you need to do to get through to them again. It's just a lot more time consuming. And then after you record the manufacturer, as I alluded to, you want to call the manufacturer of every single item exposed, or in the case of usually government agencies, call the local immunization program. The manufacturer or that immunization program will ask for the lot number, expiration date, and the amount of time exposed. So that's all that data we collected earlier. And they will tell you, they'll advise you for further action. So they'll let you know, for example, this particular vaccine was exposed to, let's say, 52 degrees Fahrenheit for 3 hours, and the manufacturer might say, we have data to support the fact that if you expose that vaccine to 60 degrees for up to 12 hours, you can put it back in the refrigerator and use it through the expiration date. That would be an example of something they might say. If they do say something like that and the vaccine is still okay to use, you need to document who you spoke to as well as ask them for a case number. And the case number is something they should be giving you, and it's a very common thing that they do. And staple all of that data for every single thing in your refrigerator or freezer to your temperature log, where you're going to keep the temperature logs for 3 years, and you can refer back to that case number and the person that you spoke to. The last step that's really, really important, the reason I bolded it, is that whether or not the vaccine is still good, you do need to mark everything in the refrigerator that was exposed. Even if you can put it back in the refrigerator and use it through the expiration date. One thing you'll notice they ask you if you ever do have to go through this is that they'll ask you if these vaccines or medications have been exposed to an excursion before. So they might have evidence to support one excursion to, let's say, 60 degrees Fahrenheit for 12 hours, but they wouldn't have evidence for 2 separate excursions, and so that could make the difference. And so you need to be able to separate the inventory out that's already gone through an excursion from the vaccine or medication that you purchased since the excursion and that has never been through an excursion. And then finally, we need to do our root cause analysis. We need to find out what happened, why the problem took place in the first part. We need to adjust the unit, correct any problems, given another 2 to 7 days of stable readings prior to moving anything back into the unit. So for example, I had a facility one time where I had an excellent refrigerator, but the thermostat in the refrigerator started to go out. So that would be an example of a problem we needed to identify. We got an HVAC technician in there who identified that. They put a new thermostat in the unit. We didn't have to buy an entirely new unit, and it started keeping the temperatures within probably 2 or 3 degrees Fahrenheit, so an excellent range. So these are the resources and references for today. I did want to leave you with some of the most important ones. The CDC Vaccine Storage and Handling Toolkit. I would strongly encourage you to go to immunize.org. They also have all of the forms you'll need. They have the temperature monitoring logs. They have a checklist actually to make sure that you've complied with every part of the storage and handling toolkit. That's an excellent resource. We have some more resources to actually give you some more data. The Demystifying Medical Grade Refrigeration is an excellent resource describing how pharmaceutical grade refrigerators are different from a household unit. And then lastly, I gave you the original 2012 study of the Vaccines for Children program. So with that being said, I'd like to open it up for questions, and if you aren't able to get your question answered today, or you feel like there's something later on that you didn't think of during the webinar, I want to please encourage you to reach out to me. Email me, feel free to, and I would love to help you in any way that I can. as you work to protect your vaccine and refrigerated medication supply.
Thank you, Alex, for the very informative presentation. And we've already had a handful of different requests to get your slides. And so I wanted to let everyone on this webinar know that Alex has graciously agreed to share his slides. So as a follow-up to this event, you'll receive an email, and as part of that email, we'll provide instructions on how to get copies of these slides. We're now ready to move to our question and answers. And as a reminder, please submit your questions using the questions pane on your screen. If we don't get to all questions, we'll make sure that we'll follow up, or we'll work with Alex to follow up to all the questions that come in. But the first question that we have for Alex is, if the refrigerator records temperatures, do I still need to use a separate data logger?
Not if the refrigerator, the thermometer that's within the refrigerator unit fulfills all of the requirements of the CDC's guidelines for thermometers, which again, many medical grade refrigerator units do provide that temperature monitoring equipment.
Great, thanks. Thanks, Alex. The next question is around VFC products. Can I store VFC vaccine in the same refrigerator or freezer as my private stock?
You certainly can. The only thing with the VFC program is they do require that you mark the vaccines as VFC vaccines. You noticed it in that example, the picture of the vaccine that was frozen, they just had a sticker that said VFC, so that would be considered compliant with the VFC program.
Great. Our next question for Alex is around a comment that was made around chart recorders, and a slide said not to use a chart recorder for temp monitoring, and the question is, why is that a recommendation?
Well, the actual chart monitoring units aren't considered accurate enough. So when we talked about that plus or minus 1 degree Fahrenheit, I think their goal really was just that the digital monitoring just made it a lot easier to read the temperatures and was more accurate. And again, one of the most important features of any thermometer is having that glycol-filled probe, so that we're measuring vaccine temperature and not air temperature.
Great. The next, we have a couple of questions that have come in around the use of continuous monitoring devices.
Okay.
Kind of a two-part question here for you, Alex. Is continuous monitoring a requirement or a recommendation? And then the second part of the question is, if you use a continuous monitor, do you still need to check and record temperatures twice a day?
Yeah, certainly. Those are both great questions. So the CDC does currently call continuous monitoring a recommendation, but as I had mentioned earlier, I would never go without continuous monitoring again. It cost me $3,000 not having it in a facility in the past. So even the continuous monitoring thermometers are around, if you were to just buy one aftermarket, they're brand new. They're around maybe $100 to $200. So I would strongly encourage you to use that. The second part about checking the temperatures, it is really important to still check the temperatures twice a day, and the reason for that is so that you keep an eye on the temperatures. So the last thing you want to do is pull a vaccine out, administer it, you're not watching the temperatures, and then you find out, let's say 3 days later, let's say for example the alarm goes off in the thermometer, or the thermometer's battery dies and you're not noticing it because you're not recording the temperature, and you have no idea if you had an excursion, if it was in range. That's just a really uncomfortable conversation to have with a patient. It also provides you the opportunity to check the refrigerator itself, make sure that the door is closed, for example, the seals are still working fine, check your stock. So the CDC does still require that you check temperatures twice a day.
Great, thanks, Alex. Another question that's come in is around the time we need to keep temperature logs. So the question is, how long is it required to keep a temperature log?
Yeah, another excellent question. The CDC recommends 3 years. There could be some state-specific recommendations surrounding that, so I would check with your state requirements. In particular, if you work for a government agency, it's possible they have a longer time frame, but they do recommend 3 years, and that allows you to track trends in temperature. And so you can, for example, see if your refrigerator is starting to drift. And so then basically troubleshoot any potential problems. And like I mentioned, in the case you have an excursion, you have some data to support that excursion that you're storing for a while.
Great, thanks. The next question for Alex is it safe to have a probe in water for monitoring temperatures?
Well, the probe is actually, it comes pre-built inside of that. It's actually suspended in glycol. There's no need to put the probe itself in water, but when you buy the thermometer itself, it will come with that vial of glycol that it's already suspended in, so that's not anything you need to do after purchasing the thermometer.
Great, great. And see, we have one other question that's come in, and just a reminder, if anyone on the call has questions, please enter those questions in the question pane on your screen. The next question is a dorm-style refrigerator ever okay if it does not have the freezer compartment inside or no freezer compartment at all?
So in that case, it might be considered a freezerless compact refrigerator. And the CDC does say that it's okay to use freezerless household units. However, as I mentioned earlier, I personally have experienced too many problems with household units to ever use them again. If you're storing vaccines, it's very likely you have a lot more money in those vaccines than you'll ever have in a refrigerator, even if you buy a pharmaceutical grade refrigerator. So I would just strongly encourage you to not even really ask yourself that question. Just consider a pharmaceutical grade refrigerator or freezer. One of the startup costs of even being in the vaccine business itself, of even administering vaccines, it really should just be something that you do.
Great. Well, thanks again, Alex. And that brings us to the end of the questions that have come in on our screen here. I'd like to thank everyone on our webinar for participating this afternoon. Please use the email addresses that are displayed on your screen if you'd like to contact Alex or our Helmer team with any questions or further needs around support. If you have any feedback or comments you'd like to share specifically about our webinar program, or if you have any comments or recommendations, please reach out directly to me, Ben Greenfield, at bgreenfield@helmerinc.com. Every participant of this webinar will automatically receive a follow-up email that will include a survey. We really hope that you complete our survey to give us feedback so we can follow up on our event with additional webinars with topics and subject matter that's based on your feedback. This concludes today's program. Thanks again to Alex, and thanks to everyone for participating. Have a good rest of your afternoon.